My dear postgraduate students, clear, correct, and concise. This shall be our logo for Tips for MD Path. The topic for the day shall be microwave processing. Time isn't the main thing, it is the only thing. Miles Davis. A beautiful saying that could be applied in many a situation. These shall be the steps in conventional tissue processing, variable at different institutes. Initially, we have got the ascending grades of alcohol, followed by a clearing with xylene, impregnation with paraffin, and finally a mold is being prepared. So these are the conventional steps. I would like you people to kindly go through them for a second. The importance here is the total time that is consumed by this method. For the next few slides, I shall be wandering with some slides with which we shall be trying to find a way to unknown destinations. This is a pressure cooker that is ordinarily used for cooking, in which the cooking is dependent on the amount of pressure that is created. And this is the suspension of a brain in a brain jar, and the fixation depends upon the volume of the fixative. These are the conventional methods. Fortunately or unfortunately, these are not the basic applications in microwave. The history behind the microwave. I shall start my wandering. This is a story in 1933 wherein a woman is tasting the baked biscuits. And then came the birth of the electric oven that was used for various purposes, such as cooking and heating. And it was based on vacuum tube and shortwave diathermy. This is downloaded from the Wikipedia. There are various stages of the development in the microwave oven, which include defrosting, thermal runaway, penetration, energy consumption, and vacuum decoding. These are all topics under the law of physics about which I know nothing. That is why I have landed up in the second group of biology and finally in medicine. So this is the way a food is being, rather pork it is said, being grilled. And in another state of mine in the United States, Canada is seen over here, and what happened was when a person called Spencer's, he was working on some other gadget, he found that the chocolates in his pocket were melting, and that gave birth to the microwave oven. This was happening several feet away, but then the effect was so much that it melted the chocolates in his pocket, and then came the birth of the microwave oven. It is basically based on electromagnetic radiation, dielectric heating, with which, as I had mentioned, various gadgets were progressively created. Tapan in 1955 was the person who designed it first, but it happened to be too large to be accommodated in any room. This followed was followed by Amana Corporation in 1970, wherein they have found a smaller version of the microwave. And there is a reaction called the Maillard reaction, which regulates the temperature. Westinghouse, on its part, demonstrated the cooking between two plates. So this is the historical background of the microwave processing. And look at this one. It is a bun that has been heated or cooked in an oven. The only difference is whenever we cook an object, there is a tremendous amount of heat coming from outside so that the external part of it gets charred or heated, whereas the inner part remains in a molten state. In the microwave processing, on the contrary, the cooking starts from within, and this is the final area that will be covered. So it is an introversion of the conventional cooking. The principle is very well explained in the diagrams over here. There are two. This is what we follow in the routine day-to-day cooking. Conduction. Any form of heat. It can be a burner or it can be an electric source. You find that there is a breakage of the molecules and then there is a rearrangement of them. So this is the conduction method of heating. The microwave, on the contrary, again there is an amount of energy that is created within and it goes on either direction. Look at the arrows over here, whereas here it is coming from outside inside. You find again there is a dissipation and the cathode attains immense charge of positive and negative, and the molecules are arranged in various patterns. This is the principle of the microwave. And the oscillation of these charged molecules is the basic principle of the microwave. They rotate at a tremendous speed of 2.45 billion cycles per second. And a great deal of energy is obtained when it rotates for about 180 degrees. Molecular kinetics is the basis for the generation of heat. This alone you people shall remember. All the others are conventional things beyond our scope. Microwaves, stimulation of the polar molecules, collision, rotational energy, etc. And finally you find that the whole material gets uniformly affected in a microwave processing. The nucleic acids, of course, are denatured, paving way for subsequent processing. This picture is again repeated. Repetition is the mother of knowledge. Conduction from external inside, and there is a heat over here, wherein in a case of microwave there is an internal energy that is being generated, rearranging the molecules. And the same thing is showing in a diagrammatic pattern which you people can draw in your exams. So this is a microwave, energy is obtained from within and then it moves in various directions. And look at the time frame, within a short time you attain the maximum temperature. Whereas in a conductive one, it is from outside and for the inner part to get heated, it takes a very long duration. Hence the longer time for conventional processing when compared with microwave processing. WW2, what is it? This is World War II, and there were several warplanes that were introduced into the sky, and they were being monitored by the radars, both for bringing down the enemy planes as well as guiding our own. They were being used, and this happened to be a turning point for our topic. As I had mentioned earlier, you find that this is the central region wherein there is an energy that is being obtained in the cathode. There is a breakup of the molecules. Usually what happens is they are confined within a circle, but here provision has been made for the extensions of these. I will be showing this in the next diagram also. So you find that there are pockets of extension and it goes within. Normally what happens whenever an energy is being created, it gets lost also. This is called half-life. But in order that the energy be preserved and prolonged, they built a case around it. That is what you are seeing in the brown. So this is a case that preserves the energy. If you are not sure about it, see the next picture. So this is the cathode. Immense amount of energy is being produced and there are the particles with the positive and the negative charges. They are going in a radiational form into the various pockets that have been created. And in order that the energy not be lost, it is encompassed. And this is called the magnetron. Physics, as I told you earlier, a subject that I never understood. And this is the magnetron that was designed by Randall and Booth, and it is called a cavity magnetron. Again I repeat, there is a cathode over here and there is immense amount of energy that is created by any of these forms, and there is a dissipation of the material, and this leads to further energy, and for the energy not to be lost, the entire thing is being encompassed, and this is called the magnetron, which is the basis of microwave processing or microwave heating. And history continues. So this is a microwave oven that's being used in the kitchen. There is some food that is being cooked or heated. So it is used for cooking and heating. The principle is electromagnetic radiation. The polar molecules rotate, and it was used initially during the World War II and designed by radar range, R.A.T.S Spencer. But there is a difference between this that we use in our kitchens and that we are going to use or show in the histopathology laboratory. What are the differences? You people should tell me. So this is what we are using in the histopathology laboratory. There is something called the data screen. So I will be knowing the various processes, the temperatures, etc. on the data screen. What is the specimen or the number that is being processed, etc. How many times it is being run. Everything can be controlled from outside. And here there is the additional stainless tray. So if in case you need more and more of this, they can be placed here horizontally, and the stainless trays are here. There is also a provision for extradition of the fumes. All the fumes will not be contained inside, they will be extradited. And there is a filter called the charcoal filter that controls this. For showing you the temperature, there is a sensor lamp that is over here. The software is also controlling the stirrer that is inside. The stirrer is not what we see as a rod that is plunging inside, but it is the disc that is over here. Look at the pointer over here, tip. So there is a circle over here, and this will keep rotating. That is for the uniform heat to be shared by different parts of the specimen, the biopsies or the sections that you had given. Also, we will not be opening it continuously and seeing. There is a provision for a pinhole camera through which we can see what is happening inside without affecting our eyes. So this is closed and the process continues. I would like you people to kindly rehearse this again and again. This can be one of the most important points for your examination. And the author of this has claimed the difference. This is the conventional processing, he says, and then this is the microwave processing. And they say that it is fairly good or on par. Now, what is the role of microwave in histopathology? Designed by Mayers in 1970, it was used in physiotherapy initially, but later on it became applicable in fixation, all the other steps of histopathology processing, staining, electron microscopy, antigen retrieval, as well as immune techniques. So after all this, you find that the microwave could still be used. I would like you people to kindly repeat this. So these are the applications which we shall again and again be seeing. Now, what are the technical advantages of the microwave tissue processor over the domestic oven? Not over the conventional processing, but over the domestic oven. There is a safety, there is reproducibility, the sample quality is maintained. It is not like overheating or underheating. Always it is the same. There are no hot spots or uneven heating within the specimen. Due to the magnetic stirrer, you find that this is maintained. Adequate ventilation of the fumes. Go to the previous picture, you will be able to identify. And both fixation after the chemical bondage being broken and stabilization, the microwave stimulated fixation can proceed. So these are the various things. And they say that instead of formalin or formaldehyde fumes, you people can use what is called as glyoxal based fixative. Sometimes these trade names they will not divulge because it is their trade secret. So something has been specially implemented and used for these gadgets. So it is important, kindly read this. There are some disadvantages. I mentioned the advantages. However, there are some disadvantages. Tissues such as the uterus are unsatisfactory because of poor fixation. The uterus again, it is smudged due to poor penetration of the various reagents. The fixation itself is suboptimal fixation, not ideal. Colon is another specimen that can undergo such insult. The cellular details are not very clear. Breast, because of the interference by the fatty tissue, you find that there is no optimal fixation or clarity. This will be a little bit complex, but I would like you people to kindly memorize this. So what are the disadvantages? Poor fixation in some tissues. Uterus, colon, breast. Suboptimal fixation. Suboptimal cellular detail. Fatty tissue dropout. So these are certain things that you should bear in mind. This box alone you can remember. Whereas this is the conventional processing. This was the first slide that I showed you, and this is supposed to be the most sincere technician in our laboratory, the histokinete, who continues to do the work day and night and even during Republic Days and Independence Days. The advantages are the chemical bonding is there, clarity of the sections, the histology is very well preserved, it has stood the test of time, it interacts with the various special stains as well as HNE, and overnight processing is possible. So even now the processing is going on in my college. The disadvantages are you find that small biopsies give rise to thick sections. I was wondering why, whether the technician is at fault, but then it happens so. During conventional processing, for some reason or the other, the small biopsies produce thicker sections. Optimal clarity in some tissues. And there is suboptimal fixation again in a colon. So we should be careful when we are handling different kinds of specimens. So this is the conventional advantage and disadvantage. And these are the various tips. Again, I had shown you in the first slide, the various stages are there. You people already know isopropyl alcohol, xylene for clearing, paraffin wax. Initially it is impregnation followed by embedding. The total time that is taken is about 450 minutes for the conventional tissue processing. 10 to 12 hours is the time, average time that you people can remember. And look at this picture over here that has been retrieved from the net. The difference between the microwave and the conventional. In the microwave, there is a tremendous amount of energy that is created in the core that dissipates outside. Therefore, the entire specimen or substance gets heated uniformly. Whereas in the case of a conventional processing, you find that the energy is from outside and it takes time to get penetrated to the core of the tissue. This is a difference you people can bear in mind. And also, I told you that there are different laws of physics about which I am not aware. There is something called the radio wave, the microwave, infrared, visible light, ultraviolet, X-ray, gamma ray, etc. But the lesson here is one form of energy gets converted into another form, and ultimately this can be made use of. That is what we are finding in and around us. Look at your own house or the room where you are staying. You find that different forms of energy are getting converted to another form. And this is the microwave processing. Earlier we had seen the conventional processing. So in this, again, almost the same substances are there. Instead of xylene, chloroform is being melted over here, molten paraffin for impregnation, and the entire thing takes about 55 minutes. Where is 450 minutes? Where is 55 minutes? Hardly about 1/10 of the time. And the steps are the same. This you people can revise any number of times, it is worth it. This incidentally, I told you about a plate being kept so that you can increase the space and the number of trays that are available for processing. Anyway, this is a microwave with a partition, and it can be used for semi-automation. And when we use certain gadgets, initially you find that they are all mechanical, then they are semi-automated. Finally, they become automated. Obviously, I think you people can appreciate the difference between this and this. Here, it is almost automatic that certain things are happening. They are just dropping it inside and the processing is going on. There are so many changes that I am confused about life right now. Everything has changed, and we have to change with the changing times. Everything has changed except the harassment of students. What do I mean? Syphilis, amyloid, AIDS, microwave. What is the similarity or the connecting point between all this? My dear students, they are all university questions for you. And look at the relationship between syphilis and microwave, amyloid and AIDS. There is no logic at all, but it prevails. This tabular column is important for you people. What are the myths and realities regarding microwave processing? The common perception, that is the belief, is it is used for food samples. Secondly, the rapid processing does not preserve the morphology of the tissues. Antigens will be lost. This cannot be used for molecular studies. And the day processing system is a waste of time. These are the common perceptions. Whereas in reality, the heat is from within and it is dissipated to the tissues. Therefore, the entire morphology is well maintained. It consumes less than 1 to 2 hours of time. Some amount of antigens will be lost, but then important antigens, optimal antigens, can be retrieved. Microwave does not affect DNA or RNA protein quality. And the day processing that is done by the microwave is equal to the conventional processing. And the thing is, you will be able to get the slide and the diagnosis the same day for better patient care. So, regarding the advantages and disadvantages, I would like you people to kindly remember this in the morning. Small special sleep in electric trains. Stupid mnemonics I like very much. So there is an electric train. Hope you will be able to remember this. Small special sleep in electric trains. Small for small specimens, special for special and routine strains. Sleep, it is not sleep that is important, leap. Loop, electrosurgical excision procedure. In IHC, immunohistochemistry. Electric, elimination of the xylene. Trains means T, stands for turnaround time. So this is a mnemonic which I want you people to kindly by heart it is worth it. Probably a great idea. I hope you are able to identify this gentleman. And this again are the things. Leap alone I will explain over here. It is supposed to be a procedure. What happens when a malignancy is suspected by cytology? They take a biopsy, almost like a core biopsy. It is processed by microwave. In case, and the patient can also be sent back to the ward. In case it turns out to be malignant, the patient can be admitted and the surgery can be done the same day. So, do this procedure at 8 o'clock, the surgery can start by 2 o'clock. That is what it means. All the other things have already been mentioned in the earlier slide. Kindly go through it. It is not equivalent to frozen section. Frozen section is when the patient is on the table, and it is to preserve fatty tissue, and some morphological changes can be lost in frozen sections. Both are not the same. And this is the milestone is a company. There is a microwave tissue processor. It is being kept over here. As I told you, there will be a rotator over here, and it is being controlled externally. The moment they kept in, keep it inside, everything will be processed, and then they close it. After some time, it comes out and the next step is being repeated. Look at this. That particular step is over, it comes out, and then you can, all that you have to do is to change the container. For example, from xylene, from alcohol to xylene, or from xylene to paraffin. It has to be changed. And ultimately, you people can carry out the embedding in impregnation and the embedding in wax. So this is a beautiful picture. The source is given over here. Science is stranger than fiction. Nobody can imagine that things are going on their own. Probably we will not be required in future. Time is a storm in which we are all lost. So the main principle of microwave processing is time. And I hope you people answer all this. The steps in tissue processing, the time taken, what are the principles of the microwave, what are the components of the machine, differences between conventional microwave, uses, and the historical landmarks. Gracias.